Hello, hello. Good morning, all. Am I audible? Great. Today we will have an interactive session. So I request all of you to make your video on so that we can have discussions. Good morning, sir. Dr. Priyul. Traveling by train.
Good morning, sir.
Very good morning. Soon we will starting our session. Good morning, all. Are you all ready? Great. So we are starting our sessions with the prayer.
जय करे, हमको मन की शक्ति देना। मुश्किलें पड़े तो हम पर हित न कर्म कर, साथ दे तो धर्म का, चले तो धर्म पर, खुद पे हौसला रहे, बदी से ना डरे, दूसरों की जय से पहले खुद को जय करे, हमको मन की शक्ति देना।
So, giving tribute to our great master Samuel Hahnemann for giving us the wonderful science, the divine science, and taught us dare to be wise. Seeking blessings from my guru, our guru, Dr. Praful Vijayakar sirs, who have made this divine science and bridges with the modern science and made homeopathy easy like mathematics. Jai Hanuman, Jai Homeopathy. This is my mentor and the biggest inspiration in the field of homeopathy, Dr. Jitesh Chosalia. Special thanks to my mentor for giving me this science and giving me knowledge in this field and my inspirations of being a homeopath because I am the allopath. So thank you, sir. And one of the pillar in my life is my another mentor, guide, guru, and a friend forever, Dr. Suketu Shastri. He had guided me in each and every endeavor of my life from day we joined together, and I learned a lot of things from this man. So special thanks to my this mentor, Dr. Suketu Shastri. Sir always says that I do not see what mind does not know. So most of time we came across many things and we cannot get what it is. Or sometime we have the patient and patient is giving a symptoms, but if something is not installed in our brain or our mind, we cannot get what it is. So that is what sir always says, I do not see what mind does not know. So the idea of a question answer session is something like that many of the students in my clinic they ask me many questions about sir how to approach, how to do this, how homeopathy is working. So there are a lot of questions from the students. So I thought that I will try my little best try to give you idea about how homeopathy is working and how to approach the cases. So before taking a question answer sessions, I must have prepared a little presentations on the approach of the disease because this is the questions of many of the students of the homeopath. So I will start my presentations with the process of approach of to the different cases. So most of time we came across cases and we have to deal with these cases. So, how to approach the cases? So, we will make a little interactive session. So, you can answer and you can unmute yourself, and again, you can mute yourself so that we can have great discussions. So, how to approach different cases? Any inputs from the students for the query? So, the process is like that. To approach the different cases, first and foremost things we have to understand what type of cases came to us. Unless and until we can understand what type of cases came to us, then and then we have the plan and roadmap to treat that case. So first and foremost things is to define the destinations. So if we have to go to certain destinations, So we have to define the destinations, and the destination is a precise and a fixed. Then and then we have a route and a roadmap to reach to that destination. So that is what the things we have to keep in mind, even in practice also. So most of time we came across this type of the illness which is comes to us in the physiological changes, the illness which is comes to us with the consolidations or the fortifications, or illness we came across are the destructive illness. So first and foremost things, our compass of learning is to define the illness in these three process, that it is a physiological, either it is a constructive illness or it is a destructive illness. For that, we have a 1 month discussions or a reading of the book End of the My Assumptions of Miasm by Dr. Praful Vijayakar. So that gives us the idea of the process, and that process is a defense process of the disease. So how the person comes to you is depending in which process, either a physiological changes, either some fortifications or consolidatory changes in the cellular level, or either destructive changes at the cellular level. So that gives us the idea that the person is defending if physiologically it is a storically, if fortification it is a psychotically, and if it is a destructive tendency, then it is a syphilitic. So most of time we have to categorize the disease in this three frame. The first point, now we have to came across the two type of the disease, that the disease is of acute origins or the disease is of a chronic origin. So if the disease is of a short duration, so rapid course, and uh, it is a temporary and either may end into recovery or into death. So these are termed as acute disease. So mostly the physiological in nature, and the process is going on inside the acute disease is the inflammatory process is going on, or sometimes that inflammation goes out of control leading to destructions, or sometimes may end into death also. So that is what whenever the patient comes to us, we have to find out that how the patient is in acute presentations, so acute physiological or acute uh, fast moving syphilitic acute. So this is what divided into two categories, that is the physiological inflammations in control form, that is the inflammations in a control is a psoric, and when the physiopathological the inflammation goes out of control, it is called a pseudosyphilitic. So whenever the psoric cases comes, the different approach, whenever the pseudosyphilitic cases comes, the approach is different. So this is what keep in a mind, that we have to make a roadmap for destinations. And if the patients come with the long standing disorders, and there is the pathological changes, mostly the structural changes. The structural changes can be of a two variant, either a constructive structural changes or the destructive structural changes. If the pathology is of a tumor, a cyst, hardness, a thickening, a sclerosis, these are called as a constructive pathology and termed as psychosis. And there are certain destructive pathologies like ulcerations, the degenerations, destructions, the gangrenes, the necrosis. These are the destructive pathology and termed as a syphilis. So in this phenomenon, we have to came across the two process, that is the illness are of acute and chronic. And according to that, we have to divide the roadmap to the sorosyphilitic, psychosis, or syphilis. Or there may be the complex process called a sorosychotic, psychosyphilitic, or sorosyphilitic. So this can be the process you can think of, or sometimes the sora, psychosis, and syphilis. These are the complex phenomenon in one patient you can find out, and then you have a roadmap. So first and foremost, we have to understand what disease is patient presenting to us. The second point we can think of, that what we learn from our predictive school of homeopathy, that is the we have to more emphasize on the genetic trait, and that is governed by the genes. So reversal is not possible with any remedy that remove just the symptoms. So again, in the time of Hahnemann also, it was written that the symptoms gone and the disease remains. So that is what some remedy can remove the symptoms. But you need to, if you need to reverse the case, or you need to reverse it or restore it in a permanent manner, then and then you need to consider the genetic trait. And that's why you need a genetic constitutional simillimum, and that term is coined by our beloved Dr. Praful Vijayakar sir, and can only bring about the cure according to the Haring's law of cure. So this is what we have to keep in mind, that we have to prescribe the genetic constitutional similum. Then there are many students who have a question that what do you mean by genetic constitutional similum. So in a later slide I will explain about this, but be sure that keep in a mind that we need to treat man, and that man is composed of the system, that system is composed of the organs, the organ is composed of the tissue, tissue is composed of the cells, and cell is composed of the nucleus and chromosome, and the chromosome is made up of a DNA and RNA. So that DNA and RNA is nothing but a genes and the genetic code. So this man, we have to treat the man in disease, so we have to treat and understand the gene of that person, the genetic trait of that person. And by considering this process, we came across that the idea of a genetic constitutional simillimum. The simillimum is most simillimum to that genes, a particular genes. So that is what Sir has said, and the only reversal is possible with the prescription of this remedy, and we can see the Haring's law in each and every cases. So, whenever we have the idea of acute disease and the chronic disease, then and then what Master Wisdom has told us, so that whenever you find out something in acute cases, you need to find out something which is exciting cause specifically. And whenever you came across to the chronic disease, you need to find out the fundamental cause, a chronic miasm. So this is the wisdom of Master Hahnemann that tell us that useful to the physician in assisting him to cure are the particulars of the most probable exciting cause of the acute disease, and also the most significant point in the whole history of the chronic disease, to enable him to discover its the fundamental cause, which is generally due to a chronic miasm. So in this investigations, what we need to do in acute, we need to find out the exciting cause. In a chronic, in this investigations, the ascertainable physical constitutions of the patient. So that physical constitution is also denoted by the genetics. So we need to understand the genes, especially when the disease is a chronic, his moral and intellectual character. So this is the behavior adapted by the persons due to their genetic tendency, his occupations, the mode of living and habits. These are the epigenetic factors, his social and domestic relations, his age and his desire, that is sexual functions, etc., are to be taken into consideration. So this is what you have to keep in mind whenever you are treating the patients as a whole. So in acute cases, the exciting cause is most important. In a chronic cases, everything is most important. So by dividing this in two process, that the acute cases, so in acute cases we need to find out the ailment from, it is most important, most important. Whereas in a chronic cases, again, keep in mind that in a chronic cases, if the miasm has been bloom from sora to psychosis or psychosis to syphilis, then the soric cause is not important. Keep in mind. This is what very important aspect of understanding. So in acute, the ailment from is most important. In a chronic, the cause is not so important. But if it is a cause of a syphilitic origins, say for example, ailment from humiliations that gives rise to a syphilis, or that is gives rise to a necrosis of the bone, then you can enter through this. This is what something that is matching with the miasm. So in acute, the find out the first the miasm, and mostly you can find out the sora and the sorosyphilis. So this is what the very important aspect of understanding. The approach is divided into two process. In acute, you can look for this. In chronic, you can look for this. Again, the second point in acute is a change disposition. So change disposition is something that is the genetic trait or adaptations to a particular trauma during that phase only, and they change from the normal. Previously it is not like that, but after this trauma it become like this. So that is the change dispositions, and that has to be counted into considerations, and that is the most important aspect of entering into the case. So that is the second point, the change disposition. And sir has given us a beautiful chart, the chart of acutes for many remedies, more than 60 70 remedies from our Materia Medica. And this chart has given a wonderful result in more than 70% cases of acutes with a single dose. So that is what you can use the acute chart. Add thermal and thirst in the acute process. So that is what the things you can think in the simple acute cases, purely a soric in nature, a simple fever, a simple diarrhea, simple cold coryza, not a recurring, but a simple. In that case, you can take it as this the entry point. Whereas in a chronic cases, the first and foremost thing you have to understand the miasm. The miasm can be a psychosis, the miasm can be a syphilis, miasm can be a chronic sora going toward the psychosis. So that is you have to find out into this, and on the basis of that, the basic disposition, that means the genetic tendency from the childhood to till date, they remain the same, the trait remain the same, the adaptive remain the same. That has to be taken into consideration. बचपन से सर ऐसा ही है, बचपन से सर ऐसा ही है, ये बचपन में भी ऐसा करता था, बड़ा होके भी ऐसा ही कर रहा है. So that is the innate characteristic of that personality, and that is called the basic disposition that never change. And a certain tendency, like a physical tendencies, like the hemorrhagic tendency in the childhood, a tendency to catch cold easily, tendency to epistaxis. So this has to be counted as a genetic tendency into the case. Some have a tendency to the sprain easily, so that is the genetic tendency of that particular person. So that is taken into considerations. Plus add thermal and thirst into case, so you will get the idea of how the disease has been taken into consideration. So this is what the approach to the acute as well as chronic cases. Let's have example with the cases. So I will share a few of the cases. Already I have shared these cases in one of the YouTube lecture also, but again I am trying to share with you so that you can get the idea how the acute case is presented to you. The one approach is this, which I have mentioned earlier. The second things which I have is the look for the prominent things in the patients whenever the patient comes to you, and enter through that case and you will get the result. So let's have a few cases of acute with the use of repertory. In organon of medicines, what Master Hahnemann is telling us that in each and every cases you need to find out the SSUPS, the singular, striking, uncommon, peculiar, and the strange symptom. So whenever you have this SSUPS, that is what Vijay sir told as a syphilis, a different type of syphilis, the peculiar symptoms, that is you have to take into considerations, and on the basis of that considerations you can get a result. So this is what very important aspect of understanding in this case. What is written in aphorism number 153? In this search for the homeopathic specific remedy, that means the remedy for the case, not the specific remedy for the disease, the remedy for specific to the case. That is to say, in this comparison of the collective symptoms of the natural disease with the list of the symptoms of known medicine, in order to find among these an artificial morphic agent corresponding to the similarity to disease to be cured, so law of similarity, the more striking, singular, uncommon, peculiar characteristic sign and symptoms of the case of a disease are chiefly and most solely to be kept in a view. So this is very important aspect of understanding this. You can take striking, singular, uncommon, peculiar sign and symptoms of the case of the disease. For it is more particularly this that very similar one in the list of symptoms of the selected medicine must correspond to, in order to constitute it most suitable for effecting the cure. So this is what, whenever you want to get a cure in a patient, you need to find out this SSUPS. This is what keep in a mind. This is the things which is helping you to reach to the core of the patients or the case. I have heard in many seminars also that the case has been given you a PQRS symptoms in the first 5-10 symptoms or first 5-10 minutes of the case. The patient is telling you everything PQRS. But it is our eye do not understand what the patient is telling to us. So this is what you have to keep in a mind, that the be vigilant and be what we called as very attentive and sound sensitive, so that you can get idea that the patient is telling you a PQRS. Why I am telling you? Because whenever the acute patient comes to you, in acute cases, the patient gives you a very PQRS symptoms, which is very evident to physicians also. And that is something that is striking to the physicians also. But if the physician cannot understand what is striking it, then and then we can become so much so confused about the acute, and we are failed in giving result in this type of cases. So again, the aphorism number 5 tells is the most probable exciting cause in the acute case, and in chronic case we need to find out the fundamental cause. How can we find out these striking symptoms and evident symptoms from the patient? So it was also given by the masters in the wisdom of this, that the take note of nothing in every individual disease except the change in the health of the body, of the mind, body and of the mind. So you need to observe the change which is having. The notice only the deviations from the formal healthy state. क्या बदला हुआ है? That has to be taken into consideration. ये कैसे पता चलता है हमें? This is by given, this is given by the individual in three forms, which is felt by the patient himself, remarked by those around him, and observed by the physician. So this is what something, the three things has been kept into view. Sometimes the patient comes to you and patient is giving you some PQRS sensations about their presentation. I will say one example, that the patient came to me with the acute abdominal pain, that is a physiological pain, and the patient is saying that sir, my abdomen is something like मेरा पेट ऐसा है ना, लकड़ जैसा कड़क हो गया है. On examination everything is soft, but the patient is telling that the sensation that लकड़ जैसा कड़क हो गया है. So that was the PQRS symptoms is told by the patient, and on the basis of that, I searched this rubric in the Robert sensation, that abdomen feels sensation as if of a wood. So on the basis of that, I prescribed Crotalus foridus to that patient, and that patient was better within 2 days. So that is what a physiological sensation and a physiological disease with the striking PQRS symptoms. Many a time you can came across the symptoms which is remarked by those around him. So patient relative comes to you and patient relatives gives you a PQR symptoms, that ऐसा हुआ है. So one fine day, one small kid came to me with the complaint of acute diarrhea and a fever. So mother came with the that small boy, and one of the boy's friend came with that boy, mother, and two boy. So one the patient and his boyfriend. So I am asking about the what was the cause is happening. So mother says that up till 5 o'clock he was absolutely fine. He came to me in the evening. Up till 5 o'clock he was absolutely fine. He came from the school. He is absolutely fine. He went down to the play, to the ground, and he is playing. And suddenly at 6 7 o'clock he came back to home, and suddenly he slept and he got a fever and 2 3 times a diarrhea. Okay, so at 9 o'clock the patient came to me, in the evening, and the history is like this. So I asked about what happened, what happened, what happened. So mother told nothing, everything is fine. He was absolutely normal till 5 o'clock. He came from the school and he went down to the play. But the things which history I got from his one of the colleague, his peer who is playing them. So he said that uncle क्या हुआ ना, हम लोग खेल रहे थे तो पपी के बच्चे से खेल रहे थे. So there was in a society there was a dog and there is a puppies. So they are playing with the puppies and suddenly the dog mother came and she was barking. So suddenly that child was losing the temper and he goes in the scared form and he scared that dog mother behind him. So that child was told me the history कि ऐसा हुआ कि सर हम लोग खेल रहे थे पपी के साथ और ये भी खेल रहा था तो ये वो डॉग की मदर आई और उसने हमारे पीछे लगी और उसने वो बार्क किया तो ये डर गया और डरने के बाद सीधा ये घर चला गया. So that was the things which I got from this remark by those around him. So on the basis of that, I prescribed the diarrhea from fright and fever after fright. The remedy prescribed was the opium because he was so much so dull and sleepy after that, and he went to home and slept. So that is what the things you can keep in a mind. So first case which is patient symptoms, the second case which is striking to us, that is those remark by those around him, and the third thing mostly we came across most of the observations in the patients. So you can see the patient comes to you and the patient is not giving a proper answer to you इन एक्यूट केसेस. सर बस कुछ नहीं है, बहुत ज्यादा क्वेश्चन मत पूछो, मुझे आज अच्छा नहीं है, आप दवाई दे दो फटाफट. So whenever this type of attitude comes to you, you can think of that patient is, you can feel that दवाई लेने आया है या खाली बातें करने आया है. दवाई चाहिए तो मेरे को हिस्ट्री तो चाहिए ना, बट पेशेंट इज गिविंग यू हिस्ट्री इन टर्म्स ऑफ दिस इरिटेशन, इन टर्म्स ऑफ not giving answer. So this is something which we called as angry when obliged to answer. So this is what you have to observe this, and on the basis of that observation you can prescribe a certain remedy. So this is what things you can think in acute cases. It is very evident and striking to you unless and until our mind can perceive these things in a better sense. Again, Master Hahnemann has said that in acute cases everything is very rapid, everything is very fast, and hence everything is striking to the physician. So keep in mind that that striking symptoms is guiding you a PQR. Patient आके बोलता है sir I am a sulfur, give me a sulfur, but we cannot understand because of we cannot understand the striking symptoms or we cannot understand the language of the person. So in aphorism number 82, the duty of the careful apprehensions of its ascertainable symptoms and characteristics as is indispensable for the homeopathic physician, as it was before that discovery, as no real cure of this or of other disease can take place without a particular treatment, that is the individualization. Here, Master Hahnemann is telling about the process of individualization. That means Master Hahnemann 250 years ago knows about the treatment of an individual with the genetic concept. That's why he has put is individualization of each case of the disease. Only that in this investigation some difference is to be made when the affection is an acute. So अगर हमारे पास acute disease आता है तो हम क्या करेंगे? An acute and rapidly developed disease, and when it is a chronic one. So chronic में different है, acute में different है. क्या है difference? तो difference ये बता रहे, seeing that in acute disease the chief symptom strikes us and become evident to the senses more quickly, and hence much less time is requisite for the tracing the picture of disease. तो कभी भी इन एक्यूट केसेस ज्यादा लंबा हिस्ट्री लेने की जरूरत नहीं पड़ती है क्योंकि पेशेंट ऑलरेडी आपको पीक्यूआरएस और ट्राइकिंग सिम्टम्स दे रहा है. ठीक है. Much less time is required for the tracing the picture of the disease, and much fewer questions are required to be asked. as almost everything is self-evident. So this is what a self-evident, everything is self-evident. Then in a chronic disease, which is generally gradually progressing for the several years, in which the symptoms are much more difficult to be ascertained. So difference ये है, एक्यूट में सब symptoms easily मिल जाते हैं, chronic में हमें ढूंढना पड़ता है, मेहनत करनी पड़ती है. So हम देखेंगे केस. अभी ये हमको पता चल गया कि एक्यूट में एवरीथिंग इज स्ट्राइकिंग है, तो हमें क्या देखना है. सो दिस वाज द केस, अ वेरी केस ऑफ अ सिंपल एफ थे. Middle-aged man came with a complaint of pain in the mouth, showing that there is a small FA in the mouth below tongue since 2 days. So I must examine and see that. I took a photograph, but it is very small and painful. Okay, so painful FA. Then I asked everything. He said nothing. No, sir, nothing, nothing, nothing. So this is what something. How can you approach these to this type of cases? Anyone have idea about this? How to approach this? A case is closed. Let's have some chat and discussions. This was the case since 2 days, purely acute, small FT, showing that it is a very small. Even in an image also you can perceive that it is very very small. And again the patient is telling me there is a pain. Yes, no chain. Ask about the anger. Absolutely anger. We can ask about the anger. Sometimes we can ask about the cursing, the ulcerations on the tongue. We can ask about the cursing. Yes, absolutely. Location is the most important. Very good, Dr. Monica. Ulcer at the base of the tongue. Absolutely, we can think of that. Again, you have to keep in a mind that what is actually the ulcer and what is actually the FC. Very important aspect of understanding. So FT is a self-limiting. FC can recover easily. Ulcer can require something. Pain, even a small, that is very PQRS. Absolutely, the patient is telling the sensation, the peculiar sensation. No sensation, patient is telling me painful. सर बहुत दर्द हो रहा है. इतना छोटा है पर दर्द होता है. Absolutely, Dr. Shivam, the small painful ulcers. Yeah, absolutely, he is taking tobacco. Absolutely, the observation is absolutely good. Exactly. Apthes, small and sore. I think you have seen this video. So already I have this case in another lecture. So the rubric rightly spotted by Mahima, that is apthes, small and sore. So my entry is like this. I took apthe under tongue and apthe small and sore. So when I combine these locations, the importance of the locations and the PQRS patient presentations, yes, apthe is soric, ulcer is syphilitic, rightly said by Dr. Raj. Absolutely. So this is the soric cases. So on the basis of this, see, in this case, I do not take any activity. In this case, I do not take any thermal. I do not take thirst, nothing. But something which is striking and self-evident to you, that has to be taken into consideration. So that is what Master Hahnemann is telling you. Once you don't have idea about this, you can have this different view. So you can view with this view and take it as it is. So this is what I took from this. So on the basis of this, tongue under F and another is F small and sore. So I prescribed Madorinum 1 day. Within 2 days, the patient was absolutely normal, no pain. F was healed because it is Sora. So same case I came across again in another case. The patient came with again a middle-aged patient, F below the tongue. Also there is a tip of tongue. And patient is telling खाना खाता हूं ना तब दर्द होता है. No other complaints. So this is what the small things. Yes, absolutely. FT is a self-limiting. Most of time it is required. There is a pain. There is a anything which is a pinpoint and that pain is giving a symptom to the patient, that's why the remedy has been prescribed. Okay, apathy is absolutely self-limiting, or sometimes the general physicians prescribe the multivitamin for the apathy, and within 3 to 5 days the apathy relieves. But in this case, the patient is presenting with the small apathy with the pain, and that is pain is hurting. That's why the medicine has been given. Yes, absolutely, you are right. I don't know the name. Your presentation is something like a Motorola G40 Fusion, but the case is giving you, see, the patient comes to you means for what? The patient comes to you for the relief. So unless and until you find out something, and you can, is there is a trivial symptoms like the changes in the error or indisposition, in that case you can have a SL and wait for 2 to 3 days, or sometime there is a full moon or a new moon phases, and mild changes in the physiology giving rise to a few indisposition symptoms. At that time also you prescribe SL and wait and watch. But if the patient is presenting to you with the pain, that means the patient having some symptoms, and that is the striking. So that's why I have prescribed in this case. The same case, another case, the middle-aged male patient with the FT below tongue, also tip of the tongue, and painful while eating. So what could be the presentations in this case? How to approach? No other complaint, and again the case is closed. As usual, patient is not giving any thermal thrust, nothing, everything. Sometimes it is the physician's duty to observe in details, observe in a very quick manner so that you can get the idea. So again, I use the same reference from the previous case, aphthe under tongue, aphthe at tip of tongue. Absolutely. The location is most important. Everything is most important. So aphthe at tip of tongue. Yes, coated tongue. The coated tongue is a general symptoms, but you need to find out the PQRS. So here I spotted again with the same Madorinum. I prescribed Madorinum 1 ml to the patient. Within 2 days, he was absolutely fine. So on the basis of this, I learned that Madorinum is the remedy for the FT under the tongue and FT on the teeth. So in acute cases, you can find out this. So these are the two cases which gives me idea about the self-evident symptoms of the patient. I will share another acute case with all of you. A small kid, almost around 1.5 years old, came with the complaint of the fever since yesterday. There was a mild cough. The child was very irritable and cranky since morning and having salivations. He came with the mother, and generally he used to look at me. Most of it, I will share the posology in a later part of this session, so you will get the idea why one and why not 200 and everything. Don't worry about it. Question will be taken care. So the child came with the fever, and generally the child came to my clinic. I used to have a chocolate box in my clinic, so child always having great conversations with me. But this time, this child was irritable and cranky since morning and having a salivations overnight. The mother says that he was not sleeping properly and there is a salivations overnight and evading the look. So this was the observation of myself that he was not looking at me. Okay, this was the change things which I found previously. That child also came to me with the different complaint, but at that time he was playing with me. But right now, after fever, he was not looking at me, evading the look. The thirst is normal. Stool yesterday, constipation today morning he passed normal stool. Urine normal, yellowish and a slight offensive smell. So I asked about what happened 2 3 days back. So most of time we have to get the idea that some element is going on into this case. So always find out the exciting cause. So in that case, I asked about something what happened before 2 3 days. So mother said that 3 days back, the mother and child went to some social functions where child was very irritated and does not like to be with the strangers. So there is a get together, social functions all are. So he was so cute by look, so everyone wants to play with him, but the child was irritable. So everyone in function is try to give love and care as him, but he was not like that, and he was very irritable during that event in the social function. So reactions. So I asked about what was his reaction. So even mother says that even koi वाल करे तो irritate થઈ જાય. That means even someone is like to give affections and love and care and caressing, he become irritable. So even a person who is touching his cheek, so he didn't like this. So this was the child reactions. So and after coming to home at night, he awakes from the sleep and cries suddenly in the midnight after 12:30 to 2 a.m. around it happened, and it happened since 3 days. And then today, yesterday night, yesterday evening, he got the fever, cough, and he become irritable since the morning. So this was the case. Now, what should be the consideration into this? How can we approach this type of cases? What element to be taken into consideration in, or what was the presentations of the child into this? Anyone? Irritable on approach? Yes. Do we have any rubrics like this? Irritable on approach. There is a rubric that fear of being approached, aversion to stranger or the touch. Absolutely, that was one of the things. Aversion to be touched. This is a syphilitic, a sorosyphilitic. Absolutely. Anything you can get from this? Evading the look of others. Absolutely. The rubric, the remedy is gallic acid. Yes, a small child, I cannot take aorta mostly. I can take the irritable crankiness more than the aorta. Aorta is mostly found whenever the patient is conversing you or answering you. So in a small child of 1.5 years, I cannot take aorta. Anything else? Yes, ailment from anger, rightly spotted by aversion for caress, caress being Dr. Anand. Cranky child, don't like to be caress, caress aversion to be absolute. You all are genius. So you know what is PQRS in the case. The PQRS in the case, a small child of 1.5 years, they want love from everyone. But here he was different. He was a different kind of personality, and that personality is that he don't like a stranger, he don't like to be careless. Even someone is trying to give love to him, he don't like this. So this is very important that the small child does not like this. So here the possibility of the rubric which I thought during the case was evading the look. The first things which I came across is the evading the look. So whenever I thought the evading the loop, there are the rubrics like the EU, I evades look of the others. क्रॉस रेफरेंस में लिखा है एंगर लुक्ड एट व्हेन कोई सामने देखता है तो गुस्सा आ जाता है किसी को डर लगता है सामने देखता है तो डर लगता है उसकी वजह से वो इवेट करता है किसी को ऐसा लगता है कि मेरी जो कंडीशंस है उसको सब लोग ऑब्जर्व कर ले इसके लिए वो इवॉर्ड करता है और someone does not like to be or cannot to be okay looked at. So this is what the things. Sometimes the child become very sad, morose, sulky when looked at, or a weeping children's when looked at. The reaction is different. One is a fear reactions, one is a weeping reactions, one does not like, one is become morose. So this is what the evading look having a different possibilities. But in this child, evading look is just my observation. So previously I think of this type of rubric, but this is my observation. What I think of in this child is cares aversion to be, cares ailment from aggravations, क्रॉस रेफरेंस में लिखा है टच aversion to be, absolutely rightly spotted by all of you. Again there is a rubric which we called as anger cares from, मतलब कोई उसको प्यार करता है तो गुस्सा आता है, या कोई उसको प्यार करता है तो उसको कोई फर्क नहीं पड़ता है, इनडिफरेंट स्टेट में चला जाता है, indifferent apathy cares to, quieted cannot be, patting and caressing are of no use, मतलब ऐसा बच्चा है जिसको शांत करने में मदर फादर की हालत खराब हो जाती है, उसको बहुत प्यार से पैट करते हैं, कैरेस करते हैं, पर ये शांत बंदा नहीं होता है. सो दैट इज अनदर वे ऑफ प्रेजेंटेशन. और द प्रेजेंटेशन इज वीपिंग कैरेसिंग फ्रॉम, कोई प्यार करता है तो रोना आ जाता है, दैट इज ऑल्सो अ डिफरेंट वर्जन. सो आउट ऑफ दिस आई टुक this rubric, cares aversion to being, and the presence of the stranger aggravates. उसको मदर के साथ कोई प्रॉब्लम नहीं था. यस, माइंड टच aversion to being caress, बट हियर मैंने जो लिया वो दो ऑब्जर्वेटरी सिम्टम्स, मतलब मदर की हिस्ट्री पे से जो मिला है वो कैरेस एवर्जन टू बीइंग, मतलब एक बच्चे को जो प्यार चाहिए वो प्यार तो सब दे रहे हैं पर इसको पसंद नहीं है. दैट इज अ सिफिलिटिक चाइल्ड at the level of mind, but the presentation is not syphilitic. Keep in mind. Okay. And the second thing is stranger presence of stranger anxiety. Most of you can in a developmental age at the 6 to 8 month, the child having the stranger anxiety has been developing, and gradually at the 1 year child understand who is this and who is the family member and who is the stranger, so he can have idea about that. But here the presence of many people, many strangers, many relatives, he cannot bear it. So that is what presence of stranger aggravate. On the basis of I prescribe Sina 1M 3 doses, and within 2 days the child was absolutely normal, no fever, irritably went away, and everything is fine. So this is what you have to look into consideration, that the ailment from. So one case we have things the self-evident two case of apathy is telling us the self-evident striking symptoms. Here we can take the ailment from another case which was a search case, and the case of the same remedy. I will tell you the answer in posology sessions about the doses. Don't worry. Yes, absolutely. The child was very cooperative because I used to have a chocolate in my clinic, and he was very, very playful with me. But that time he was evading look. That's why I thought this rubric. And that is what the PQRS of the change dispositions. Okay. Yes, one dose is sufficient, but I prescribe 3 doses, 1 hourly to the child because child has a high fever, one not two fever, and mother was very anxious and worried. But mother knows that every time the child got fever, he has to admit into hospital. But since few months when she came to me with the medication, so she was convinced that no need of medication, no need of antibiotic, or no need of any hospitalization into the child. So she was like that, and on the basis of that I just, everything is clinical experience, so I prescribe 3 doses to this case. Now another case which I need to share with you is the case of sir Vijay sir, which was taught in the sir's webinar. So this was the case of sir, male aged 43, got hemiplegia on the right side, was admitted in hospital in ICU. His brother, who was working with sir, told his uh, this is at 11:30 at night on the phone. Sir asked him what happened during the day, any quarrel, any fight, any conflict. So no history of any anger, fright, and grief. He himself could not talk due to paralysis of the tongue. His BP was 200 by 120. In the family, almost all uncle had died of the hypertension and heart attack. He just told me the doctor want to start intravenous antihypertensive. Sir told them to wait and sir asked him what you see and observe about his behavior regarding thermal thrust and generals. So the accompanied person said that he said only one thing I have noted last 1 hour he is asking for something to eat like a biscuit. The patient having a hemiplegia and he wanted to eat like a biscuit. He was admitted in the hospital. Fortunately, doctor was known to sir and had faith in homeopathy. Sir told him, "Let me try with 1 dose of homeopathy medicine. If he does not improve, then you start your protocol." So, on the basis of this, the patient having a hemiplegia and the change in the generals like a thermal thrust or generals, the change in the generals is he wanted to eat something. That means he was hungry during that state. So sir took one rubric which is very PQRS, that is paralysis general paraplegia with hunger, and the remedy was Sina. Sir prescribed Sina to that case. Sir said just wrote on a piece of paper and kept in a pocket Sina 200. Within 5 minutes, the blood pressure became 180 by 110. It was 200 by 120. Another 10-minute BP was 180 by 106. Another 10-minute BP was 150 by 100. Patient slept. Next day, BP was 130 by 80. So the presiding doctor called sir and asked how it is possible that without administering any remedy this could happen. Insina antihypertensive is an antihypertensive. Can I use it in another case along with our medicines? This was the question by presiding doctor to the Praful Vijayakar sir. So whenever the physiology is working, at that time our medicine is working in this manner. This was the sir's understanding and the protocol, and sir has given this idea that our medicine is nothing but information technology. That means the information has to be passed on to that particular genes through any of the senses, either of inhalations, either of oral, either of local applications. So, or sometime the hearing. Sir has tried hearing also. In many cases, in the physiological cases, the information of the right remedy to be passed, and that has corrected the physiology of the patients. So for more understanding on this, I request those who have not done SCPH, please do SCPH so you can get the idea how our homeopathy working at the quantum level with this kind of methodology. So the idea of learning this is, let's have some entry point to learn about the Sina. So Sina is a remedy that is desired to be carried but dislike to be handled. मुझे कैरी करो पर मुझे हैंडल मत करो। अगर कोई मुझे हैंडल करने वाला है या कोई मुझे इंटरफियर कर रहा है तो वो मुझे पसंद नहीं है। मैं इरिटेबल हो जाऊंगा, मैं क्रैंकी हो जाऊंगा। सो द डिजायर टू बी कैरिड बट डिसलाइक टू बी हैंडल, द ओनली रेमेडी इज सीना। द रूब्रिक विच confirm that is aversion to be handled, aversion interference, aversion to interference. If you take the child by the hand, it cries terribly. The only Sina is the remedy, and aversion to be careless. So these are the syphilitic entry point of the Sina. Whenever Sina is not only a child remedy, you can think of Sina when the patient is adult and we who is behaving like a child, who is behaving like a child with repulsive mood and the quarrelsome nature. You know, this is very important aspect. Behaving like a child means it is not a childish behavior, but behaving like a child with the repulsive mood and a quarrelsome nature. Adult who hate company, adult who hate to be touched or caressed, adult who hate to be approached, aversion to interference, aversion to be handled, though wants to be carried, and who have an increased hunger. These are the Sina adult. So you can think of Sina when you have this type of presentation to you. So This is what just about the SINA. Another case of acute neuritis. This was the case. The patient came to me with the complaint that there is an acute complaint started since today morning. There is a pain and burning in the fingertips of a right hand. Pain and burning in the fingertips of the right hand. There is a numbness and burning feelings in the fingertips. So I asked about, tell me the sensations. So she said that the sensation that એવું લાગે કે દરવાજાની અંદર આંગળી આવી ગઈ હોય અને કેવો દુખાવો થતો હોય એવો દુખાવો ફીલ થાય છે. That means she said that if the finger is being in between the door and it was like so much so pain when the door is being closed, so it was a crushed type of pain is feeling inside the patient. That was the sensation. So this is what you have to keep in mind in an acute case. Everything is self-evident. So the case is closed. How to approach this type of cases? Tell me. If you have this much of symptoms, what is the idea? So in this case, I just took a few symptoms: localization, upper limb, fingertips of burning fingertips as a sensation, sensation as if crush fingertips, and sensation as if squeeze between the door. Okay, so that was the sensation a patient is telling you. These are the PQRS sensations, and in that sensations, I prescribe, yes, absolutely, Asisha, the fingertip being crushed acid. Absolutely. The remedy prescribed is causticum. So causticum 1 ml, 3 doses, 10-minute interval, and within 1 hour, patient has reported me that the pain and burning has been reducing drastically. So that is what the things you can think of, self-evident things in the acute cases. So these are the few presentations of the acute cases that help you to approach in the cases. So the first two cases gives you a self-evident things. The third cases gives you a element from. The fourth and fifth cases gives you something that is the PQRS sensations. So the sensations also gives an idea that you can enter through. Okay. Now, when you have a chronic cases, you have to go with the process of GCS, and for finding out GCS, you need to know the basic dispositions, tendency, and thermal thrust. So, to prescribe GCS, what we need? So, to prescribe GCS, we need to find out first the miasm, means the sora, psychosis, and the syphilis. Then according to that, the approach is like this. This is a very clear cut slide that is prepared by our beloved mentor, Dr. K. Patel, who had made this for us presentations, and that is very snapshot. So whenever you have a physiological disorders, you have to look into the first column. Whenever the pathological constructive disorders, look into middle column, and whenever the pathological destructive structural disease, look into the last column. So according to that, your approach also decided, and according to that, your remedy is prescribed. So in the first, physiological functional disorders mostly represent the inflammation in the form of heat, redness, pain, infections, irritation, spasm, sensitivity, neuralgia, or change in the biochemistry. So in that case, do not require any GCS. In that case, you require a physiological acute remedy and prescribe on the basis of acute, and you will get the wonderful result. 60% cases comes to you in a clinic with this physiological disorder. Rest 40% is of a chronic disorders. It can be a fortifications or it can be a destructive disorders. So when there is a structural changes of the growth variant of fortification, the fortification can be hyper access or hypo less, which is represent in terms of the accumulation, proliferation, depositions, or synthesis, which we termed as all psychosis. In this case, the GCS is required. GCS means genetic constitutional simillimum. And when there is a destruction, which is due to the process called as apoptosis, apolysis, or necrosis, or gangrene, which is represented to us in the form of either exaggerations, distortions, perversion, hysterical, and destructions, and autoimmune and genetic mutations. These are the seven syphilis which you all need to learn. For understanding of the better understanding of the seven syphilis, I must advise to go to the SCPH class, so you will get the idea of how syphilis has to be treated with this 7 point. So in that case, there is a two-way approach. One require a GCS or one require a state remedy, which we called as a PCS, and followed by a GCS. So this is what the approach is like this. So this approach of the disease, if you have inflammations, what you need to find out, you need to find out the cause and find out the ailment from. So that is the entry point of the case and does not require a GCS. In pathological structural changes of the fortification, that means the psychosis, you need to find out the cause, but cause is not the ailment, but cause is the fear or a certain perceptions of regarding the insecurity. So that has to be fear and insecurity and certain perceptions in the form of a delusional you can find, and on the basis of that you prescribe a GCS. Or in the third cases, you can find out the syphilitic cause or anything which is out of control, either in the form of behavior, either in the form of emotions, or either in the form of reactive patterns that has to be find out of control, and the perceptions, the altered perceptions, which is a syphilitic in nature in the form of either a delusions or a delirium, and on the basis of that either you require a GCS or a state followed by GCS. So this is what the basic approach of each and every cases. Now, to prescribe GCS, what we need? So we need to understand the need and sensitivity of the individual. We need to understand the disposition, and we need to understand the syphilitic symptoms or the altered perceptions. For two things, need and sensitivity and disposition, you will go to the YouTube videos on the Happy Gujarat channel where you find the need and sensitivity lecture, 4 5 series, and disposition 6 lecture series. So you will get the idea of how to prescribe GCS and find out this. Now the question is, what is GCS? Since morning sir is telling you GCS, GCS, and GCS, so what is the meaning of GCS? So GCS is something which is coined by our sir. So, what is genetic constitution simillimum? The dictionary meaning of word constitutions is the physical makeup of individual, the structure, compositions, and makeup of something. The word constitution means relating to the constitutions of the body and mind. So, the meaning of the word constitutional simillimum means the most similar remedy to the physical or the mental structure, compositions, and makeup of the individual. This is called GCS. So gene and constitutions, every human beings and every cell has sets of genes. These sets of genes express themselves in the form of two kind of the protein. One is called as a structural protein and another is called as the humoral protein. Structural protein gives rise to a physical body and humoral protein gives rise to a biochemistry and the emotions. Again, what Master Hahnemann says in the aphorism number 5, I'm going little fast because I need to have a question answer in later slide, so I'm going little fast. So also Master Hahnemann is telling that the physical constitution is most important in each and every cases of the chronic disease. So how can we ascertain the GGS from the patients? For making it easy in a practice, Dr. Vijayakar sir has divided the ascertaining of the constitution under three headings, that is the mental makeup, physical makeup, and the general makeup. So mental makeup consists of the extroverted, introvertedness, will, intellect, moral, expressions, sensitivity, attachment, likes and dislike at the level of mind, and a tolerance. The physical makeup, general makeup consists of the feed of the person's activities, side effects, and stability, type of pathology involved. All is general such as thermal thirst, sleep cravings, and aversions. Eliminations like a stool, urine, and perspiration. So this is what you have to consider. as a general makeup. And the physical makeup, it is like a build, structure, hair, face, height, muscles, fiber, postures, etc. So this is giving us an idea about the GCS. So whenever we have to prescribe the GCS, we have to consider the physical makeup, we have to consider the general makeup, we have to consider the mental makeup, and on the basis of that totality we prescribe one remedy, that is called GCS to that case. Now the question is GCS versus PCS. Here the PCS is coined by a pathological constitutional similum or the state constitutional similum, that is particularly to particular state. Okay, so GCS is, as we have taught by our sir, that the GCS is based on the will, intellect, moral, attachment, sensitivity, physical generals like thermal thrust, aversion, desires, and the physical particulars. So on the basis of that, whenever you find any remedy, it is GCS. What is PCS? The concept of PCS can be thought in a destructive, life-threatening autoimmune disease and a cancer. So most of time you can have a life-threatening disease when the patient is on the deathbed, or is in the ICU, or the patient having some autoimmune disease, or a patient having a cancer. At that time you have to prescribe the PCS. In case of autoimmune disease, need to be probed the cause and effect phenomena. So what is the cause of autoimmunity and what is the effect of autoimmunity? Both has to be taken into considerations. So cause and effect phenomena. So here cause must be autoimmune or a destructive, that means a syphilitic in nature, and effect in terms of the sphere of actions or a pathology or a tissue involved or a part affected. So in most of autoimmune cases, we have autoimmune disorders related to the joints, autoimmune disorders related to the cartilage, autoimmune disorders related to the connective tissue, autoimmune disorders related to the glands. So in that case, the sphere of actions or the pathology or the tissue involved, that has to be taken into considerations. Also consider the reactions after the autoimmune disease. So many a time the patient may land up with the reactive emotional pattern that I don't want to live further. So that is what the syphilitic reactions, or sometimes the patient says due to disease or after disease that I want to die soon or I want to die early. So that is what the death desire. That means autoimmunity means the gun toward the self. So I must kill myself, and that is what the autoimmunity. So here the mental picture is something like a death desire. So that desire is the syphilitic reactions of the autoimmunity. So in many of the cases, whenever you didn't find any of the things, you can directly take the death desire as the entry point in autoimmune cases, along with the sphere of actions of particular disease, and that is you can take. And also the change dispositions after the disease has to be taken into consideration. So that is called syphilitic emotional reaction. So how you find that syphilitic emotional reactions? So entry point in the fast destructive and autoimmune disease is something which is a false perception which lead to autoimmune process at the mental plane. So sometimes the person feel that the all the things which I have done is wrong. So person having the perception that I had done wrong, I am the criminal, I have committed a crime, or the person having the guilt. So the guilt of something which lead to the false perceptions of something that lead to the autoimmune process, and that is what the things is to be considered into a case as a cause. Then the affinity, particularly of the organ or the sphere of action, and the syphilitic reactions, mostly the death desire in most of autoimmune cases, you can take into consideration. Again, when the autoimmunity get reversed through the parameters you have prescribed after the PCS, then consider the original nature since childhood, the basic nature of the sensitivity of the child, the soric need, innate dispositions, and the sphere of actions of the genetic constitutional C minimum has to be prescribed. So this is what we have to understand in a very brief manner. So there is a two remedy required in autoimmune cases. One is the autoimmune remedy, that is PCS, and one is the GCS, that is the innate characteristic from the childhood. Hope you got the idea of this GCS and PCS. So this was my process of giving you a approach, understanding of GCS and understanding of PCS. And now we are starting with the question answer sessions. So you all have asked very beautiful questions, and these questions will give you an idea of understanding in a better and a far manner, so that you will have a great practice in the future. So first of all, I must thank you all of you for asking the questions, and this is my little effort to give you an idea about something which I learned from sir and I learned from my mentors and everyone. So this is what might try to give you an idea about this. So the first questions was asked by Dr. Kruti Sangani from the Surat. She said that facing a difficulty in finding the rubric from the patient history according to the miasm. So as such, the answer is like that. You need to understand. Will tell you everything. Wait, Dr. Mira. Understanding of the miasm is the most important to treat and understand the patient as a whole. So most important aspect of understanding is to understand the patient, and the approach is to understand the miasm. Again, we have learned that miasm is a defense mechanism from the genetic code, which is governed by the cellular functions and represent at the defense of the cell. So either we have understood that the cell defense either physiologically or morphologically. So physiologically represent as the function and sensation, so it is a sora, and morphologically in a two-way, either a constructive as a psychosis or a destructive as a syphilis. So whenever you came across that in the patient history, so you need to find out what is the patient is defending. If the patient is defending in a soric way, or is the patient is defending in a psychotic way, or is the patient is defending in the syphilitic way. The first and foremost thing you can get from the patient disease history, that patient is giving you history that I have a nasal polyp, so that means the patient is defending in a psychotic way. If the patient is telling you that I have a recurrent tonsillitis or I have a allergic rhinitis, so that is the patient is defending in a soric way, but in a chronic form, the chronic sora. So, in the same manner, the cell and its mind speak the same language. Dr. Vijay Sir always says the mind and body speak the same language. So, if body is defending in a soric way, then mind also defend in the soric way. So, in sora, mind represent as a sensitivity, hypersensitivity, irritability, apprehension, inhibitions, and anxiety, anticipation, cautiousness, etc. So, according to that history, you can find out certain rubric, because you need to find out first the miasm. If the same way the patient is defending in a psychotic defense, so the mind also defend as a psychosis. So this is also covered up. So in psychosis, the patient is giving you a symptoms which is exactly opposite to the patient is telling you. That means everything is covered up, everything is projections, everything is facade, everything is hoarding. So this is what something you need to go beyond. So you need to find out some fear and insecurity regarding this. Okay, so showmanship, cunningness, slyness, rudeness, manipulations, political, all are the psychosis which is giving you things. Why they become this, you need to ask yourself and then find out the history from the patient. So you will get a back behind what was the insecurity behind that. And if the patient is defending in a syphilitic defense, so the mind also defend in the syphilitic way. So when the part is destroyed, the balance is lost. And when the balance is lost, the control is lost. This is called as out of control. So organism goes further into destruction and distortion. So in syphilitic mind also, the behavior goes out of control, the behavior goes into distortion, the behavior goes into perversion, the behavior goes into ugly So this hence everything is ugly at the physical level, same way ugly at the mental level. So for that, every time you need to probe the history of the patient according to the patient suffering from the which disease. So that disease guide you that you need to find out syphilis from the patient, you need to find out psychosis from the patient, or you need to find out the story from the patients. Hope you got your answers by just understanding the process. So, syphilis represent at the mental level in the form of out of control emotions. So, for example, if a person having a anger, so anger goes out of control, it forms into the anger violent, or sometimes the rage, furies, or sometimes the insanity. So that is what out of control emotions. There is a destructions of the security giving rise to mania and insanity. So most of time the patient goes out of control haywire or goes into mania and insanity. Or sometimes the distortions of the volatile mind giving rise to perversions. So all this lead to the strange, crank, ugly behavior, eccentric behavior, and everything, and that is a syphilitic in nature. So this is what most of time you need to find out the rubric according to the patient disease history. So another questions from Dr. Nirmala Walvatkar from Nanded. Sir, what is the conflict of CKD cases and how to go about it if the patient is on dialysis 3 times in a week and he wants to stop all other treatment? The GFR is 15, serum creatinine is 12, blood urea is 114, serum potassium was 8, hemoglobin was 11. Taking erythropoietin injection weekly. The patient is very stubborn, does not listen to the family, does what he wants to do basically is nature. Yes, Dr. Kaur, you can add something to the previous questions. Yes, I will put. You can unmute yourself or you can also have a video chat. Dr. Kaur is one of my mentor. Yeah, yes, sir.
Hello.
You are audible. Yes, sir.
Yes, I'm audible. Okay.
Yeah, yeah.
Video is not getting.
Yeah. Okay, fine.
Okay,
No issue.
no issues. I will just try to explain her. Her question was how to find out the rubrics. Can we go to previous question?
Yeah, yeah. We have a previous question on the
Okay.
screen.
Facing a difficulty in finding the rubrics from patient history according to miasm.
Hmm.
This is asked by Kruti.
Yeah.
Okay. Kruti, first of all, you need to be well versed with all the rubrics of the miasm. Which particular rubric belong to which miasm has to be there in your mind. Because what sir told was, eye sees what mind perceives. So for perceiving the things, we have to store certain things in our mind first. So first of all, what you have to do is just take any drug or take all the rubrics from the repertory and just bifurcate them into Sora, psychosis, and syphilis. And according to the miasm, Amit sir already told that you need to search for the higher miasm. Whenever you are treating, when you are taking the totality of the case, and if the case is of psychosis, then what you need to do is either you have to enter through the strong psychotic rubric or some higher syphilitic rubrics, whatever you are getting in the case. Anything which is strange and unusual is usually syphilis. That you have to remember. So that try to find out what is strange in the case. Also try to find out what is a common theme of the case. Say for example, if you are getting 4 or 5 situations in a case, then try to find out what was the common feeling in all the situation of that particular patient. And from that you can form a rubric. Dr. Amit will give you the example of that. But this is what you need to do. So first get well versed with all the rubrics and the and their particular miasms.
Thank you, sir, for updating and adding idea about this. So hope you get the idea that first things what the first slide of this presentation is I do not see what mind does not know. So first and foremost thing is the installation process in your mind. So install the idea of everything in your mind and then you can get the things into it. So the second questions from the Nirmala Walwadkar from the Nanded. She was asking about what is the conflict of CKD cases and how to go about if the patient is on dialysis 3 times in a week and he wants to stop all other treatment. GFR is 15, serum creatinine 12, blood urea 114, serum potassium was 8 and hemoglobin 11. Also taking erythropoietin, he was stubborn, does not listen to the family, does what he wants to do. Basically, his nature is bossy. He is trying all sort of treatment to improve GFR rate. So again, the first and foremost thing you can know into it is what is CKD. So first and foremost thing is knowledge of the disease. Here, the chronic kidney disease is chronic inflammations of either parenchyma of the kidney involved or the interstitial tissue of the kidney involvement, giving rise to the destructions of the function of the kidney, which is excretion. So here the excretion is not possible, so filtration is not possible, and the resultant effect is the GFR is reduced, the creatinine is increasing. Okay, am I visible or not? Something went. Yeah. Now, am I visible? Yes. Okay. 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 Fine. Great. 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 So, in this case, first and foremost thing, you need to understand what is the disease process is. So here the disease process is something that is the destructions of the kidney parenchyma or the interstitial tissue. So again, first and foremost things, they don't go for the conflict, but conflict will help you to understand how the patient's life situation goes into this destruction process. So on the basis of that process, you can get the things that the person having this disease. So the miasm involved in this is generally a chronic inflammation goes into destruction means the psychosyphilitic state of mind. And again, the patient is wanting to stop all the treatment and he want to adopt something to improve the GFR. Okay. So here the conflict associated with the kidney parenchyma and this is the given by the master hammer and that is the abandonment conflict, the refugee conflict or fish out of water conflict. For further reading of this, you can go to the learninggnm.com site. But how can we find out this in the situation? So for example, I will give you an idea that the person is living in India and he is doing business somewhere in the South Africa. So he was landed into South Africa and having a big business in the diamond industries. And suddenly, what happened? The recessions happen in the South Africa, and he was having loss of business in that, and then he cannot able to come from Africa to India because of some issues there into their life due to some legalities of the South African process. And in that case, the patient is somehow patient came to India, and after 3 months of this process, he developed swellings and everything, and then he developed this. So in this situation, what he was facing that he was being abandoned, he was fish out of water at the level of that South Africa. So In that case, the patient having this process and he develop a kidney disorders. So this is what the situations gives you some process, and that is the conflict. But according to that conflict, don't take the forsaken feeling, don't take that he was alone, don't take that fish out of water conflict as a direct entry into rubric. So this is not going to give you a patient indication, this is going to give you things that is general aspects. So sir always says hammer has guided us for the case taking process for the conflict, but hammer does not give the individualization. So here the patient having a GFR is reducing, creatinine is high, and urea is high, potassium is high, and HB is low. And again, so here what was the things in your case is the destructions of the kidney parenchyma is has sets in, so filtration process of the kidney is destroyed, the miasm is psychosyphilitic. So here the chronic inflammation went into destructions of the kidney parenchyma. So as per background, the miasm is psychosis, so he might be very stubborn and rigid kind of personality, bossy personality, or sometime he want to stop all other treatment, and that is what something called as a revolter kind of personality. In spite of knowing the disease is so progressed to the syphilitic state, and he wants it, I want to stop this suddenly. So this is what something that is a revolter kind of personality. So in this case, the GCS has to be prescribed. And what I thought as a pathological rubric, in this case, what I thought as a rubric of the pathological is you can take a rubric inflammation chronic kidney parenchymatous plus cause if syphilitic you can find from the patient history, you have not given any history, plus basic disposition of the patient, and then you get the idea. So this is what you have to consider into this case. Sometime in this CKD cases you need repetitions, and that repetitions either a weekly or either a 15 days or fortnightly, so you can get a reduced number of what we called as a dialysis from the thrice a week to the twice a week, or sometime a once in a week, or many a time it happens with the many cases that the dialysis has been stopped after a 6 month of treatment also. So that can be possible. Okay, but go for the GCS and find out the patient history properly. That was the idea. I am just giving you idea about. Yes, rightly said by Dr. Keir sir that when someone is so stubborn to stop the treatment, you need to despair, uh, rule out despair and rebel against politics or indiscretion. So these are the mind symptoms of the patients. So you can take it into consideration. Either out of despair, he don't want any treatment. Either he was very rebellious kind of personality, so he don't want treatment, or he cannot understand actually what is happening, and that is what the indiscretion is. So that is what the possibility of the person's idea. Great. Thank you, sir, for adding it. So here my idea is to give rubric is just so here I am just giving you a process of fishing, not the fish, so you can get the idea. Another questions from Dr. Kushbu Varawa from Delhi. She said that what is the difference between the constitutions and dispositions? So this was the theoretical part. Constitution is equal to physical structure, biological functions, and inherited something from the environment and modified by the environment is all our constitutions. So constitutions define as two things: a physical buildup and the characteristic, which is desire, aversion, reaction, including emotional, intellectual attribute. What Stuart Close says that it is the aggregate of the hereditary character influenced more or less by the environment, which determine the individual reaction, successful or unsuccessful to the stress of environment. That is meant the things, the genetic things came from the mother and father, and the another constitutions is built up, and the environmental influence on them, and then his attribute has been started, and his individual reaction has been successful or unsuccessful to the stress of environment that are called as constitutions. The disposition is something called as a genetic trait, a character that individualizes the persons, and it is predominant or prevailing tendency of one's spirit, natural, mental, emotional outlook of the mood and characteristic attitude. So this is what identity of the person, that is a genetic trait of the person, help in individualization. So this is one's habit or usual mood, and it can be mental, physical, and general, and help in the selection of the GCS. So for all practical purpose, constitutions and dispositions are same, because we need to, at the end we need to find out genetic constitutional simillimum based on the symptomatology of the patient, which is disposition. So disposition is tendency to act or react in a specific way, or disposition can undergo changes according to the stresses of the life. Constitutions, the constitution has a sensitivity belongs to the constitutions, whereas reaction belongs to the miasm. For example, in a psoric stage, the person is reacting in irritability. But the same person, when he goes into psychosis, either he expresses anger more, or either he does not express his anger, suppress anger, or in a syphilitic state, he may goes into a rage. So reactions belong to the miasm, whereas the sensitivity belongs to the constitution. So for all practical persons purpose, in the homeopathic treatment, dispositions are the chief in the selection of homeopathic remedy to the particular individual or the constitution for understanding of our risk, but practically it is same. On the basis we prescribe the GCS. So your question of answer of the question is either you take as a constitutions or either you take as a disposition, but practical purposes we need to find out the GCS, and that is what both are the same. Another questions uh, asked by Dr. Kusum Hegde from Karnataka. Sir, one patient came for the delayed menses. Her menarche was also delayed. She had a vitiligo on both her dorsum of the feet before this amenorrhea, and she came for the amenorrhea. Then, how should our cure take place? The question is very important. Again, you need to understand that the compass of miasm is most important in each and every cases. So you have every direction to be taken into consideration. Again, here in this case, the vitiligo is equal to destructions of the melanocyte is equal to the miasm syphilis destructions. Okay. Second is the delayed menses, that is the developmental development of the secondary sexual characters. So delayed menses means the development arrested. So here the miasm is psychosis less. Both are in the fifth layer of the disease. It means Apud system is involved. Here GCS is the final tool for your case. So after prescribing the case, what should be the first to be taken into consideration? So whenever you prescribe any medicine, the physiology has to be established. That means homeostasis has to be established first. Then and then the morphological changes has been started. So in this case, the physiology will establish first. So in follow-up, the menstruation become regular soon after right GCS. Then the reconstruction process is starting at the level of melanocytes. So in this case, so amenorrhea to become a normal menses along with development of the pigment in the vitiligo port is the right direction of cure. Hope you got the answer, Dr. Kusum. So this is what the things you have to keep in mind, that you need to put miasm as a compass in each and every case, so that you will get the idea that miasm reversal is the sign of your cure process, or you are in the right direction or in the wrong directions. Another questions by Dr. Heli Patel. The follow-up criteria is quite challenging, sir. In spite of knowing certain things related to how to see the follow-up, like a general should be better, but in cases such as the allergic rhinitis, PCOD, certain skin disease, how much should we wait to see the result? How we can elicit that our medicine prescribed is right or not, and certain pathology related issues, which what cases, how much potency, how much repetition and should be done. So I need to give many answer in these one questions. So first and foremost things, in each and every cases you need to understand that the compass of miasm to be applied to your case. So if it is allergic rhinitis, inflammatory, the chronic sora, there must be the hypersensitivity. So in follow, sensitivity has to become normal. In acute recovery must ensue in a few minutes to 24 hours, while in a chronic you will notice changes in the few days of a right GCS. So this is what very important aspect of understanding. If the PCOD, so PCOD is a cyst, is a psychosis, so for understanding right and wrong prescription, follow-up is essentials and analyze with the miasm and theory of separations as a compass. So first and foremost, two book is most important to keep in mind. Then and then you can understand what is the right follow-up and what is the wrong follow-up. Again, the question of posology, many will ask about this. So I have prepared this in this later slide. So I will give you idea about this. Again, the question of how much to be weight in this type of cases. So the answer is like, if you have a acute disease, sir always says the acute psoriatic disease, sir always says within 24 hours patient has to be normal. If it is not, then your medicine might not be right. So in that case, you can think of like that. In a chronic cases, you should have a few days from 1 week to the 4 week. You can wait for, and you can find some changes in the either generals or there is an improvement, a sign of improvement. You can find from, you can see it in aphorism number 253. So if you find some sign of improvement in the patient in spite of having no particular disease has been changed, then wait for a time being that your medicine has started working. So this is what important aspect of understanding. Another question, same by Dr. Haley Patel Surat. If certain medicine is prescribed and once that medicine work and the second time that medicine didn't work, very important question, very many a time all of the practitioner having facing this difficulty. Example was given that in case of the migraine headache and acute attack, and then medicine prescribed, patient was cured that attack within 30 minutes, but the same attack next time, that same time medicine didn't have any change in that attack. So what should we do in such situation? Should we change the medicine or we should change the potency because it worked first time? Hope many of you have the same questions. So what should be, yeah, absolutely many of you have the same questions. सर पहले एक बार वो पल्सिटिला का डोज गया था, पल्सिटिला से उसको ठीक हो गया, दूसरी बार जब पेशेंट आया सेम एपिसोड लेके मैंने वापस पल्सिटिला दिया, 200 दिया, 1 एम दिया, 10 एम दिया, 50 एम दिया, सीएम दिया, वापस 30 दिया, अब ठीक नहीं हो रहा है, क्या करूं? So that was the many a time in a clinical practice. I used to have a same incidents and experience of this, but whenever you don't have an answer, you need to search the answer in the organon, and organon will give you the answer. So here in this case, when you have prescribed some medicine based on some acute symptoms, if it is a violent or either a modality or a cause, then the episode will subside for a time being. This is happening with all of us. Then we are convinced that the same remedy will be useful in that case. Absolutely, everyone is convinced that once the medicine has worked, we also convinced that the same remedy will work again. But we are desperately failing giving the result. Here, what mistake we did is when acute outburst of the Lennon Sora is covered by the state remedy. That means you have prescribed that remedy is working only on that particular state which we have prescribed. Then you must administer the antisoric remedy, that is a GCS, so that the episode will never return again. Now, where it was written? You need to find out the answer. So here the Master Hahnemann said it is in aphorism number 221 and 222. So what Master Hahnemann advised us that in aphorism number 221, it is mostly related to the mental disorders or emotional disorders, but it is not like that. The German peoples are always giving you idea that you should take into considerations as a generalized. So whenever there is a acute episodic disorders, you can take this strategy as the entry. So in aphorism number 221, however, if insanity or mania caused by fright, vexation, the abuse of spirituous liquor, etc., have suddenly broken out as an acute disease. So here you have to keep in mind that anything suddenly broken out as an acute disease in a patient's ordinary calm state, although it almost always arising from the internal sora, like the flame bursting forth from it. Yet, when it occurs in this acute manner, it should not be immediately treated with the antisoric. So here, Master Hahnemann advised that do not give GCS here. But in the first place, with the remedy indicated for it out of other class of the proved remedy, he has given example of the aconite, belladonna, ammonium, hyoscyamus, mercury, etc. And he has prescribed this remedy in many cases of this. That's why he had given this idea. Okay, so other class of true remedy in highly potentized in the sense of higher potency, minute a single dose in order to subdue it so far. So ये episode खत्म हो जाए that the sora cell for a time being revert to its former latent state. So ये episode normal हो जाए wherein the patient appeared quite well. पेशेंट को अच्छा हो गया. अभी हम यहाँ मिस्टेक जो कर रहे हैं ना वो ये कर रहे हैं कि पेशेंट ठीक हो गया, हमने एक और दवाई देनी है एंड दैट मेडिसिन इज जीसीएस, बट हम यहाँ नहीं देते हैं. तो जब दूसरी बार वो पेशेंट एपिसोड लेके आता है तब हम वही मेडिसिन देते हैं जो हमने पहले दिया था और वो मेडिसिन फिर काम नहीं करती है. ठीक है, तो व्हाट मास्टर हनेमान एडवाइज दैट इन एफोरिज्म, बट सच अ पेशेंट who has recovered from an acute disease by the use of this non-antisoric medicine should never be regarded as a cure. एक एपिसोड खत्म हो गया तो उसका मतलब ये नहीं है कि वो पेशेंट पूरा ठीक हो गया है. ऑन द कंट्रारी क्या करना है, जब हमें ऐसा पता चला कि पेशेंट को ये एपिसोड ठीक हो गया है तो हमें क्या करना है, ऑन द कंट्रारी नो टाइम शुड बी लॉस्ट इन अटेम्प्टिंग टू फ्री हिम कंप्लीटली. दैट मीन्स क्योर करने के लिए जरा सा भी टाइम वेस्ट नहीं करना है by means of prolonged antisoric treatment, that is called GCS, from the chronic miasm of the sora. So you need to give a GCS. So this is what very important aspect of understanding. Potency change किया कोई फायदा नहीं है, दवाई चेंज करी, दवाई चेंज करनी पड़ेगी. क्यों? क्योंकि आपको जीसीएस देना है. तो फर्स्ट एपिसोड ठीक होने के बाद टाइम वेस्ट नहीं करना है, सीधा जीसीएस देना है और उसको ठीक करना है. देन एंड देन यू विल गेट द रिजल्ट. सो द आंसर टू योर क्वेश्चन इज लाइक दैट you have subsided one episode with the acute phase remedy, but the patient sensitivity is not taken care, means the patient sora is not taken care into consideration. So prescribe the GCS and then you will get the result. Hope you got your answer from this wisdom of Master Hahnemann. Yes sir, yes sir, you can add something.
Aline, first of all, you need to know what you are treating. Am I audible?
Yes sir, you are audible.
So in this particular case of migraine, when you are treating a migraine, you need to consider this migraine is because of aura, psychosis or syphilis. So as Amit sir told, That first you need to rule out the miasm, what you are treating. If it is a phoric complaint, that is just because of the congestion of the head, then you have to give particular medicine at that time, which will subside the attack. But if the attacks are recurring, that means it is turned chronic, then you need to go for GCS. Because the same medicine may not work. It may work, but it may not work. Here you need to strengthen the constitution. So to strengthen the constitution, you need to find out the proper GCS according to the chart which was discussed a few minutes back, and then if you prescribe that medicine, the patient will experience less number of attacks, the frequency will reduce, the intensity will reduce, and then he will be free from his condition.
Thank you, sir, for adding some point. So, hope you got the answers. Again, your questions remain the same. The migraine cases, how much time generally it takes to cure totally? The first and foremost, many a time this was the question by the patient himself, that how much time to be taken, sir. कितना टाइम लगेगा? 6 महीने में ठीक हो जाएगा, 1 साल में ठीक हो जाएगा, 2 महीने में ठीक हो जाएगा? सर मुझे 20 साल से माइग्रेन है, कितना टाइम लगेगा? इफ इट इज अ वेरी chronic in nature, how much repetition is needed, and should we do what potency is suited generally in migraine cases? So this was the questions. So if the right GCS is prescribed, most of time in acute cases you need to subside the acute episode with the non-antisoric remedy, either a belladonna or either acute aconites or stramonium or mercury. This was given by the master Hahnemann. But if the patient comes to you with the tolerance that I can tolerate my migraine and I have not so severe episodes, so at that time you need to prescribe the GCS. It is not the time to give a PCS. So if the right GCS is prescribed, it will not take much time to relieve it. So if your remedy is right, gradually the tolerance of the patient has been increasing and the intensity of the pain and disease has been gradually reducing to certain extent, and patient is telling you that within 1 month, initially I used to have episodes every day, but since your medicine has been started, I used to have a mild episode 2 3 times, but I did not require any medicine, so that means the medicine is working. Okay, so that is what, if the right GCS is prescribed, it will not take much time to relieve it. It is the limitations of the homeopath. Uh, yeah, absolutely, Dr. Anand. If the GC is right, the intensity, frequency, and the durations of the case, those who are having a episodic in terms of either you have a epilepsy, either you have a migraine, either you have a allergic component in all cases, or either you have a urticaria. In all cases, the intensity has been reduced, the frequency has been reduced, and the duration of the episode has been reduced in the follow-up, and if it is taken care by the constitutions, do not repeat the remedy. Okay, it is the limitations of the homeopath himself that it will take long time to relieve, but homeopathy, you all know, that is rapid, gentle, fast, permanent if applied according to its principle. Again, what rightly said by Dr. K.U. sir, the migraine you are treating is because of the sora, is because of psychosis, or is because of syphilis. Mostly the migraine is the physiological in nature. So here the dynamization is so high, and so high potency is a choice of treatment. Either you can start with the 200 or 1 m, and if needed, the potency should be raised to 10 m and 50 m SOS if the same episode has been increasing in intensity. Once it is reduced for so many longer time, so that is what you need to prescribe. So this is what the posology regarding the migraine. Mostly I used to have a result in a 200 or 1 m potency. Few of the cases I have prescribed a 10 m or 50 m, starting with the 10 m or 50 m, and then got the result. So this is what mostly the 201 ml the entry of the physiological migraine. Another questions, the questions from Durga Devi KS from Madurai asking about questions is the 75 years old male patient constantly spits saliva on himself on his shirt. He has a history of large vessel occlusions of the brain vessels. MRI brain in the 2017 shows the complete occlusions if right ICA. No investigation done after that. How to approach this case? This was the things. So here you need to understand everything with the terms of what we called as the miasms. So old age people more prone to syphilitic disorders. So patient also is in a syphilitic trait. When you find anything which is out of control, either in the emotions or either in the behavior or some weird or a strange things, that should be considered as the entry point. Pathology wise, he was suffering from the large vessel occlusion. So there is a thrombosis. So it is a psychosis leading to ischemic changes in the brain. That is a syphilis. So lead to the atrophy of the brain. It is a destruction. So here the patient is in a psychosyphilitic trait. But his behavior, his behavior also gone into destruction. So strange and crank in acts and opinion is the rubric which I think in your case. Another rubric which I thought is he cannot understand what to behave and what not to behave. So that is the indiscretion is another rubric. So there must be you can think of a strange and cranks having a three remedy, indiscretion having a many remedy. The pathological rubric which I thought was atrophy of the brain as the effect plus add the dispositions of the patient, and in that case you can take a detailed history which will help you further into this case. So this is what you need to understand from this. Hope you get the some of the clue. See, every time the approach is based on the understanding of the miasm, your follow-up is also based on the understanding of the miasm. So that will help you to get the answers. Yeah, we can take the blood vessel complaints of general as another entry point also. Yeah, can also be thought of. Absolutely. Another questions, Dr. Vinaya Indrajit Katkar from Kolhapur.
Sir, if you allow, I want to add some point
Yes,
on
sir.
previous case. On
Yes,
previous,
yes,
please, previous
yes.
slide, sir, please.
Yeah, yeah. I will make a previous slide. Yes, sir. Add. Dr. Anant is with us. He is trying to add something in this.
See,
Yes, sir.
this 75 years old patient is constantly spitting on himself. The chief
Yeah.
complaint was spitting on
Yes, yes,
himself.
yes, yes, yes.
So you need to understand कि when someone spits,
Yeah.
so if you search, the spitting is the sign of anger, hatred or disrespect or contempt. कि हम किसी को मतलब जब पसंद नहीं करते, उसकी रिस्पेक्ट नहीं करते, तब हम उसके ऊपर थूकते हैं.
Absolutely.
So here patient is spitting on himself. So it
Yes.
is kind of autoimmunity. So patient has to have some anger or contemptuous towards self.
Absolutely, sir.
So you can use the rubric like contempt of self, aversion to self, disrespect to self, all related to the self rubric. So वो अपने आप को पसंद नहीं कर रहा है, वो अपने आप पे थूक रहा है.
Absolutely. That was the
So
mental. This is called the mind of pathology.
हाँ, mind of pathology.
Rightly said by Dr. Anand. This is the mind of pathology. Absolutely right,
Okay,
sir.
okay, sir.
That's great. That's great.
Okay.
So, Dr. Durga Devi, you have another aspect of mind of pathology from this Dr. Anand. So you can think like that and you can take the whole history, but I must be very basic here. So I just advise you those behavior which you find that is weird, and that is what something you can go through. So that is what I thought of this way. There is another thought that what Dr. Anante said, it is called as mind of pathology. Great. Absolutely, Dr. Anand. Another questions, the questions from Dr. Vinaya Indrajit Katkar from Kolhapur. Difficulty in getting mental symptoms. Please guide about posology, selection of the doses, and repeatability. So, as earlier discussed by me in first question also, difficulty in getting mental symptoms, that means the rubric. And so you can get the mental symptoms by two methods. One is the observations and one is the interrogations. For more understanding, you should go to the disposition lecture series in YouTube. So you will get the idea of how to probe the mental disease. Yes, Dr. Rashid Madam has added something in the message that sir always says be a referee, follow the compass of Mayasm, and it will teach you when to repeat and when not to, and when to wait. Absolutely, ma'am. This is the general idea about that, but that is what the things we have to keep in our mind. So compass is always helping us. Yes, absolutely. So the mental symptoms you need to get in the history either by the observations or the interrogations, and in this case you need to go to the YouTube video of disposition series, and in that I had taken a lecture on how to probe the disposition. So you will get the whole idea of what are the observatory symptoms you will find in the disposition or mental symptoms and what is the interrogative symptoms. So you will get that. And now the posology. Everyone is asking about the posology. Again, the question of posology is the questions of experience. So many a time everyone is using uh, experience and telling that uh, this remedy work wonder for me. So you can try it. This remedy work wonder for me, and you can try it. So whenever we are using a certain theory or compass for assessing the follow-up and assessing the disease process as a miasm and the theory of suppressions. So same way in posology also you need to assess the miasm also. So here the miasm has to be assessed according to that the posology has been applicable. So in posology two things has to be kept in a view, that you have to understand that the person you are dealing with is are suffering from a dynamic disease or something which we call as a dynamic or a static disease. So to keep these things you need to be understood by the miasmatic view, that in a sora, that means the sura means the physiological. Physiology means the ever changeable. So changeability is there in the sura. So when there is a changeability is there, that means it is a dynamic in nature. So it is always changing. It is not constant. It is not static. Okay. So that is a dynamic in nature. When then sura get change into either a constructive mechanism or a destructive mechanism, in that case also you need to find out that constructions take place slowly, so it become a dynamic gradually, and then the a dynamicity has been started. And when the destruction from this construction has been started, so it will take a longer time to construct, but whenever you start destruction is so fast. So here again from construction to destruction the dynamicity has been increasing. So this is what you need to keep in a mind. This is a beautiful round circle chart of a miasm that will help you in practical applicability of the potency in each and every cases. So that will help you how much the dose has to be prescribed, which potency has to be prescribed, and what is the repetition is needed or not needed. So generally in Sora is divided into two categories. One is the pure Sora and one is called as a sorosyphilitic. So when there is a one is a pure surah, that means from the 9 o'clock to the 6 o'clock in the this round circle, it is a purely a surah, a acute disease, and which is recover by its own, a self-limiting disease. In that disease, is the dynamicity is at particular level, a stable level. So here the dynamicity is there. So in that case, you need to prescribe the higher potency. Mostly in a psoriatic cases, sir used to prescribe a 200 or 1 m potency, and on the basis of that, most of the acute cases had been cured very easily. So this is in the pure sura from 9 o'clock to 6 o'clock. But if the sora is mingled with the syphilis, that means the dynamicity is so high, either may patient land into a destructive disorder or either may patient land into the death process. Here, the dynamicity is so high, instability is there. So, the potency in this case is from 9 o'clock to the 12 o'clock, the potency is something which we called as a higher potency. So, in that case, a 10 m potency, 50 m potency has been advisable. So, here the dynamicity. So, whenever there is a more dynamicity, higher the potency. The idea is like this: the more dynamicity, higher the potency. Less dynamicity, lower the potency. So this is what you have to go into this way. Whenever the Sora is getting converted from 6 o'clock to the 4:30 in this chart, so it is something called the accumulation. So when there is a accumulation has been started, the person becomes slower gradually. Here the dynamicity is still there, but still it is in a lower level. So in that cases, mostly the 200 potency has been prescribed. Hope you got the idea of posology. So accumulation, so accumulations of the lipid. For example, dyslipidemia is there in the patients. So in that case, the 200 potency is enough to get the idea. So this chart is very beautifully helping us, the compass of miasm helping us in the posology, so that our dose also has been prescribed in a such a way that we are not doing a mistake. Okay, so in accumulative pathology, the 200 potency is enough to prescribe. Now, when the protein getting synthesized and it become either excess or either a less, so in that case, there is a hardness, there is a thickness, there is a induration, there is a looseness, there is a relaxations, and everything is going on. So it become a slow process, a very slow and sluggish process. So here the dynamic disease become adynamic gradually. So when there is a disease become adynamic by synthesis of the protein, either fibrin or elastin in the form of excess or less. So in this case, repetitions is needed. So say for example, if I have a pen without a cap. So if I a pen without a cap having a dynamicity more, if I put the pen on the table and I give one stroke, it will go to certain extent. But if I have a pen with the cap and if I will stroke the pen, it will go to one step only. Again, I need to need further stroke to give. So in this case, the more dynamizations aid in adynamic cases, for example, in a static cases, the more stroke is required, and that is what we called as a repetition is required. So whenever you find a pathology which is synthesis in nature, there is a structural changes with the growth. In that case, a dynamicity is less and the repetition is more. So in that case, 30 or 200 potency is the best way to prescribe. Generally, sir used to prescribe 200 potency, or sometimes sir used to prescribe 30 potency with the repetition. So repetition can be of weekly, can be of bi-weekly, can be twice in a week, or I had experience that sometime in certain cases I used to prescribe every alternate day 30 potency in the morning dose. So this is what in adynamic cases you can have a repetitions. Again, when this goes into yeah, yeah, OD over so 3 days sometimes, yeah, it can be. See, the applications of the dose and the posology is purely experimental or experience basis. So this is what, but why I am using this compass? I am using this compass to get the idea that you should not be like a haywire, that in that case I need to give 10 potency. No, in synthesis 10 potency didn't work. So in that case you need to prescribe a certain uh, a lower potency, because that is what the adynamic disease, and in adynamic disease you require a less dynamic potency, and that is what the lower potency work better. Again, when the proliferative disorder started, so proliferations is always something which we called as a dynamic in nature. Again, calculi is accumulation, so 200 potency is the important, no repetitions. Dr. Anand has a few cases of calculi also, and with the single dose, calculi has been gone. So our body take care of everything. He had shared a case. Yes, Dr. Anand.
Yes, rightly said, sir. 200 potency will definitely help in calculi cases.
Yeah, you
And
had share one case
this
that
is,
yeah,
yes,
sadness as from misfortune. You had share one case with
yes.
us. Yeah.
The size of stone was about 15 mm,
Ha.
and patient was about to do a surgery next day, and he came one day before to me. And on the detailed case taking, I prescribed this Calcarea Sulf 201 dose. That
Yes.
rubric
Yes.
was sadness from misfortune. And
Yes. Yes. Yes.
within 14 days, the calculi was out.
Dissolved. Yes. Yes.
Yes.
Absolutely. So this is what something. Yes, Dr. K. You need to add something.
I would like to share one case of calculi.
Yeah.
The patient age was only 8 months,
Hmm.
8-month-old child, and there were three calculi. The highest size was 18 mm
Yeah.
in 8 months old. So
Hmm.
first of all, what we need to understand was how the child was he was on a mother's milk only,
Hmm. Hmm.
and immediately after the birth there was some pain and sonography was done, and it revealed these two. So in this case, we need to find the mother's perception and this. And same medicine was given Calcarea itself on the it was selected was inconsolable, sorry, not inconsolable,
Hmm.
delusion,
Delusion, misfortune, inconsolable.
inconsolable or misfortune.
Our misfortune, yes.
Yeah.
And calcarea self was given. Absolutely.
Calcarea itself only single dose was given. And after 4 months, all the stones are gone, they were absorbed, and the
Yeah.
child is absolutely fine.
Yeah. Absolutely. So, rightly added by both doctors. Again, when we go further from the 3 o'clock to the 1:30 in the proliferation, so in proliferations, it is something which we called as the dynamicity has been increasing. So today the cell is like this. Again, in the next 2 4 days, the cell is increasing, increasing, increasing. So this is what the proliferative pathologies like the warts and everything. Here the dynamicity is high. So in that cases when the dynamicity is high, but still it is not so high to such an extent because it is structure is involved. So here you can apply a 200 potency, and in proliferative cases you do not require repetitions because the proliferation either go into normalcy or proliferation increasing. So this is what the single stroke is enough because the dynamicity is there. And in syphilis, there is a two type of the syphilis. One is a fast moving syphilis. One is called as a slow moving syphilitic cases. So in a slow moving syphilitic cases, which is traveling from the psychosis to syphilis, that is called as a necrosis, or which we have recently we have many cases of the AV and avascular necrosis of the hip joint. So it is a gradual process. In that case, 200 potency is enough to get the result. Whereas there is a fast moving syphilitic disorders. So in that case, the higher potency like a 10 m, 50 m, and cm. Again, this was the general and brief idea about the posology, dosage selections, and repetitions. Sir always says that in autoimmune cases, whenever you have some autoimmunity, in autoimmunity, you need to prescribe the higher potency, either a 10 m, 50 m, or cm. Whenever you have a destructive disease of the nervous systems, again, in that case, you need to prescribe the higher potency, like a MND. In that case, you need to prescribe a 10 m, 50 m, or a cm potency. So this is what you need to get the idea. One thing, whenever you are treating any developmental disorders, and in developmental disorders, you need to stimulate the growth gradient. So for stimulations of the growth gradient, sir always says the moderate potency and in a single dose. So sir advised 200 potency for the growth. So in the developmental disorders like a Down syndrome, like a CP child, mutisms, in that cases, you need to prescribe a 200 potency. Whereas in cases of autism, where the physical development is absolutely normal, but the psychological development has been disturbed, and that is more dynamic and physiological. So, in that case, the higher potency works wonder, and that is what the 10 m, 50 m, or cm. So, this is the idea about a brief in the posology. So, you have to keep few words in the posology is the miasm, dynamicity or adynamicity, and according to that dynamicity and adynamicity, repetitions and the potency has been selected. Hope you all have a query in this posology has been solved.
I would like to add for that developmental thing.
Yes, sir. Dr. Nimesh sir
Yeah,
is there.
yeah, yeah. In the case of
Yeah,
developmental cases where the development is arrested,
yeah,
sir used to say that you need to prescribe single dose and
yes,
you need to wait substantially
substantially for
because what?
more than,
Yeah,
yeah,
yeah, more than 6 months, more than
six,
8 months,
yeah, absolutely.
because because whatever development that takes during the pregnancy inside the womb, it takes double time or more time to develop outside the womb. What we are doing here is we are just stimulating the growth gradient. So once that is stimulated, you need to just wait and observe the changes what are there.
Yes.
And once you get the changes, that whatever milestones were delayed, and you start seeing the changes in that development, just wait. Do not repeat. Even after 6-7 months of waiting, if there is no change, then there is no need to repeat the same medicine.
Absolutely.
You need to change the medicine according whatever you perceived was maybe wrong. So you need to
Yes, sir.
change the medicine, and repetition is allowed only and only if you get certain developmental
Changes.
changes
Changes.
and then they are again arrested
Yes.
or the status quo situation is found. Only then and then you have to repeat, and that too also a single dose.
Yes, sir. Great, sir. Thank you for adding, sir. So, hope this is a brief idea regarding the posology and the selections of the doses and the repetitions. Hope many of you have this idea is clear, but the compass of miasm is helping in also the potency selections. So, there is another questions from Dr. Khushbu. Uh, as we read today that a certain individual could be born with the psychotic or a syphilitic miasm, then when we restore this sick individual, we do not have their sora, known, then how come we find the simillimum? So this was the question from Dr. Khushbu. So if the child is born psychotic or a syphilitic, find out the sora in the mother's womb or mother history during pregnancy. This is what a very basic understanding. So that is why the MHDP is most important in each and every cases when you find the child born psychotic or syphilitic. So during pregnancy, mother and child share the same emotions and its basic need. So if child born psychotic or syphilitic, whose sora represent same as mother's basic need during the state of pregnancy. So in most of genetic mutation cases, you need mother history or a grandmother history to probe the SORA. So that is what you need to understand in each and every cases when you are treating the genetic mutation cases. So there is a SORA, and that SORA has to be found out in the mother history during pregnancy because the mother and child is only one unit during pregnancy and they share the same emotions and the basic need. Reaction of the child may be different because the child has his individual identity, individual constitution. So that reaction of the child makes the child disposition differ, but the sensitivity remain the same as mother and the emotions of the mother. Hope you got the answers. So our time is running. There are few questions are left also. So we will have another sessions maybe in the next week. So we will continue. There are 20 questions, 20 questions I had, and there is approach also. So it was a time is running so high. So we will conclude here, and there are many questions. Yes, we have how to prove the autoimmunity. So we will take next time. There is a approach. There is a case of the tubal blockage. So today I would conclude here. Thank you all for being with us. I will reopen again the question answer session link so you can ask the questions and we will have another question answer sessions maybe in the next or next to next week. So we will conclude these sessions in the next session. So thank you so much. Thank you, my mentor. Thank you, Dr. Keo sir, Dr. Anand, for guiding all of the student and teaching us. Thank you, Vijayakar sir, for giving this strength and giving the knowledge to share with all of you. Thank you all. Thank you so much. Thank you to a great master, Samuel Hahnemann, who is backbone behind me. So always guiding us, and thank you for everything. Thanks a lot. Thank you so much. We will conclude these sessions in a recent future, maybe next to next Sunday. So we'll share the link, and you will get the your answers, queries or answers. Okay. Again, I will open the question answer sessions Google Sheet, so you can ask the question in Google Sheet, and you can fulfill that questions. Okay. Thank you so much. Thank you. Thank you all. So we will conclude today's session here. Hope you all enjoy, and I request all of you, if you are benefited, you can share this knowledge with your colleagues and friends. And also, I need feedback, so I am sharing you feedback form in Google Form, so you can share your feedback with me, so I can improve this, or we will learn together and we update ourselves from this learning. So thank you all, and sir's blessing is always with us, so that is guiding us for this wonderful science, and that is why I am here to present myself with you. I am just here as a tool to give you a sir's knowledge. So thank you, sir, for guiding us. Thank you. Those who have any questions, you can ask in a Google form. So you will have another, we will have another sessions and that will fulfill your questions. Thank you, Keyur sir, for this motivations and also helping me in this endeavor. So you are always with me. Thank you so much. Even thank you, Rashi ma'am, that you have guided me in this cases also. Yeah, we will have a recorded sessions and I will share these recorded sessions in the YouTube so you will get everything. Don't worry. Okay, thank you so much. So we'll conclude the day today. Thank you all.